Our first guest is the Associate Director of Multimedia Content for Catholic Health. He's here to discuss an array of topics making headlines this summer. Welcome, Tim Kelchner. Tim, thanks for being with us.
Thanks, Monsignor. I'm happy to be here. This is an exciting new segment.
Refresh everybody about your role. I think people have kind of known you over the years a little bit, but give everybody a little sense of what your role is over at Catholic Health.
The goal is to make the title as ambiguous as possible so I can do as many different things over there on the content creation side. Just kidding, but we work primarily in video content, also with our digital marketing team. So any of the videos that you see on social media, we're also very fortunate to work with your team as well here at Catholic Faith Network to produce Stronger Together with Dr. Dave. So lots of exciting stuff. We say the doctors do all the hard work, and it's our job to showcase everything that our doctors and nurses and staff do at Catholic Health.
That's a good one, and let people know that, right? And people should know, too, the Dr. Dave Show is at a studio that is a Catholic Health studio that we kind of help them put together and stuff, which is great. It's a beautiful studio.
It's a wonderful collaboration because it really is our two teams coming together for that, and we get to produce some great content there.
So now we're talking about some of the issues of the summer, you know, some of the things that happened during the summer. Now, one that I am totally misunderstanding and don't understand is bird flu. Now, you hear about it, you read about it, and then like it's one of these things, a little hyped up saying, oh, it's crossing the country and all of this stuff. Tell us about it. What's going on? How do we protect ourselves? What's the deal?
It's really interesting because I've seen it in the news a couple times, and I thought the same exact thing, Monsignor. It's, you know, how bad could this be? What is it? So I talked to one of our infectious disease professionals, and, you know, the country we're rebounding from the after effects of the COVID-19 pandemic. You know, bird flu, it's starting to make headlines a little bit more, and you may commonly hear it as H5N1. That's what bird flu is also known as. It doesn't compare to the severity of the coronavirus, but it does continue to cause outbreaks across the country. These you may have heard of, primarily in animals such as poultry, dairy cows, and most recently, this is what's making the headlines, a handful of farm workers have contracted the virus after exposure to the animals. The CDC currently lists the public health risk as low, but I did speak with St. Francis Hospital and Heart Center Director of Infection Prevention, Dr. Alan Bolbin, and he offered this insight on the current situation.
No, it's not transmitted through milk that you buy in a store. Anything that's pasteurized will kill this virus, so you can't get it from your routine grocery store milk products or meat products. It's just not transmitted that way. It's more like, you know, what we think of with the flu, you know, droplets, coughing, sneezing. I mean, the good news is even with this new strain, H5N1, the drugs we have, the antiviral drugs that work for common flu, are active against this flu. So even if it really took off, again, would we be able to, you know, jump in from our experience with COVID and pandemic preparedness and have vaccines ready to roll? We have antiviral therapy ready to roll. So I think there's no need to really get too crazy over this. It's just they need to get in there and investigate and get on top of it. But your average person, it's still those common sense things that always work.
Well, that's one of those things, right? Because he sort of answered all the questions there. And also, you know, something that we do have a grip on if something should happen. Are we seeing cases of this on Long Island? Not so much, right?
No, not on Long Island. And Dr. Bolbin also said that, again, it's primarily right now in the dairy area, with farm workers. So I think the comforting thing is, you know, as you heard him say, it's not transmitted through milk. It's not transmitted through the meat we eat, which, again, it's that big sigh of relief.
Around the country, of course, you're watching now, you know, that's where you have to be careful in the farmlands and et cetera, et cetera. So the other thing, of course, is hot weather now. And, you know, we're into this big heat wave stuff. And, we have a heat wave now and everything. So let's talk first about kids and the hot weather. Because a lot of kids, the camps have started. They're outside. They're running around. Tips for the kids.
Right, and this initially stemmed from, you may have seen some of the legislation that's been in the paperwork, proposed legislation at this point. When we were kids, we enjoyed snow days, but now they're talking about the kids having heat days when the temperatures get to a certain level. So we thought it would be a good idea just to go over some tips. You know, end of school, there are some kids who are still finishing off this last week. You're almost there, guys. You just got a few more days left, and then summer camp as well. So we spoke with one of our pediatric hospitalists at Good Samaritan University Hospital about some hot weather tips that the kids can take either in the classroom or at summer camp.
So as the heat rises, we want to make sure that we keep the kids safe. Great things to wear are light-colored clothing that are loose-fitting. The light reflects the heat of the sun instead of something that's dark. Water's the best. You don't have to have any fancy sports drinks or any kind of sodas or sugary drinks. Just regular old water's great. You can also have really great fruits, watermelon, oranges, strawberries. That will also give them a lot of hydration, and to make sure they do it throughout the day, more so if they've been outside. You want to make sure you're putting sunscreen on every 2 hours, or sooner if they're toweling off when they're coming out of the pool, or if they're sweating a lot. You want to make sure you're reapplying.
Sunscreen's an issue. I was thinking about this because a lot of people over the weekend say to me, Monsignor, you got a great tan. Now what happens, I have one of these priest tans because I have like a color from here, and that's it. Because I take my dad, who's at one of our nursing homes, outside almost every day in a wheelchair. And we sit outside for a bit and he talks and stuff. It's great. It's a nice visit. So I'm getting this monster tan like this. And of course, the rest of me is white as a ghost. But even that, I need to be careful. So talk a little bit about sunscreen, because I think there's a little bit of drop of controversy about this out there too.
This is our last story, and this possibly is, I don't want to say the craziest, but most interesting that I found when I was perusing the headlines. Some people, I think common sense, we both agree sunscreen is good for you, but there is some clamoring online on social media that sunscreen may not be good for you and may actually be harmful for you. And I know anytime you talk about claims on social media, it comes with a little bit of a caveat, but again, some people are saying that there are chemicals in sunscreen that can cause damage to the skin, and plenty of studies to show that support this. A Florida Cancer Institute said 1 in 7 adults under the age of 35 believe that sunscreen is more harmful than the sun. Another 23% say that drinking water can prevent sunburn. Unsurprisingly, this view isn't shared by many medical experts.
I think if you weigh the balance, there are far more risks with not using sunscreen in terms of the risk of developing skin cancer as we get older. According to the American Academy of Dermatology, skin cancer is the most common cancer in the United States. And there are statistics that state 1 in 5 Americans will develop some type of skin cancer. So therefore, the benefits of using sunscreen far outweighs any purported risks that may be out there.
Nothing about drinking sunscreen. But, you know, it's interesting. I mean, Dr. Spillane is my dermatologist, and he's fantastic and really great insight all the time. But we do have to care for this skin that we have, right?
Absolutely. I think it may come down to the texture of the sunscreen. Some people feel it's too heavy, too goopy is the word that I came across a lot. But yes, sunscreen, very important anytime you're out in the sun.
We'll be careful, that's for sure. So how can people find out more information?
You can find more on these health tips, any stories whatsoever. You can check out the Catholic Health website. It's catholichealthli.org.
Terrific. Tim, thanks for being with us.
Well, thank you so much, Monsignor.
Appreciate you being here today.